Well, good afternoon, everybody. My name is Don Davies. I'm the Member of Parliament for Vancouver Kingsway and the Federal New Democrat Critic for Health. I'd like to welcome you all to our town hall on dental care. I'm zooming in from the unceded territory of the Coast Salish people, by whose grace and generosity we live, work, and play. And I'm very honored to host this panel with some really exciting folks here who have a lot of expertise and experience in oral health care in Canada. This is an incredibly important subject, and I'm going to introduce each one of the four panelists now, and then I will in turn call on them to share their thoughts on a particular aspect of dental care before we then open up to a bit of an engaging discussion between them. I'm really pleased to be joined first by Dr. Brandon Doucet. Brandon is a practicing dentist from Newfoundland with an interest in surgery and public health, and he's one of the founders of the Coalition for Dental Care. We're also joined by Dr. Kavita Mathu-Muju, who is a pediatric dentist and dental public health researcher at the University of British Columbia. We're also joined by Tiffany Ludwicki, who is a registered dental hygienist and president of the Canadian Dental Hygienists Association. And last but certainly not least, we're joined by Dr. Hasan Sheikh, who's an emergency room physician and lecturer at the Department of Family and Community Medicine at the University of Toronto. Now, before I turn it over to Brandon for his opening comments, I just want to say that as the Critic for Health for Canada's NDP, we have made it a priority to drive the concept of dental care onto the national agenda. We believe, and I think most Canadians understand, that oral health is critical to our general health. We also know that about 1/3 of Canadians don't have any dental insurance whatsoever, and the figure could actually be higher than that. We also know that there's very important social and class consequences besides the obvious health issues that happen when we don't pay attention to Canadians' oral health. This, in our view, is a historical gap that we believe it's time, in fact, it's overdue time to address. One of the steps that the NDP has taken in the past year or two has been to drive forward this idea of looking at putting universal dental care into our public healthcare system and to devise a bit of a plan to get there. So we did ask the parliamentary budget officer to cost out how much it would cost to at least start covering all those Canadians who earn under the median family income of $70,000 per year who don't have coverage. And the bottom line is the PBO found that we can cover 6.5 million Canadians who don't have any dental coverage today, who make under $70,000 a year, for about $1.6 billion a year. Now, to put that in perspective, we spend about $265 billion every year in this country on healthcare. $265 billion. So if you think of adding $1.6 billion to that, it's a pretty modest amount of money to deal with such an important part of our healthcare system. So that's kind of what we're doing on the federal level. And now I'm going to turn it over to the folks who are working in the trenches and delivering these services and see firsthand what's going on with dental care in Canada. So I'm going to turn it over first to Dr. Brandon Doucet. Brandon, can you talk to us a little bit about the current state of dental care in Canada and maybe why the Coalition for Dental Care was formed and what you'd like to see happen?
Sure. So I just want to start by thanking you for having me. And to answer the question, to understand the current state of access to oral health care in Canada, we need to look at its structure. And when we do that, we realize that dental care in Canada more closely resembles, the private American healthcare system than it does our universal healthcare system. And when I say that, what I mean is that people rely primarily on work-related insurance and out-of-pocket payments to access care. In fact, this accounts for the overwhelming majority of dental spending at about 95%. and only a meager 5% goes towards targeted government programs. This is even less than the Americans, where they spend about 10%. And because there's so little government spending, there's a very weak safety net to cover the people who lack access to dental care. And many people who rely on these programs often struggle to find a dentist who will accept them. And these programs tend to favor extracting teeth rather than saving them. And because dental care is so privatized, many people lack access to care. As Don has mentioned, there's about 1 in 3 Canadians who lack any form of dental insurance, and a little over 1 in 5 Canadians who avoid the dentist each year because of financial constraints. And when people avoid routine dental care, they have to ration the funds that they put towards care, towards dealing with emergencies, pain, and infection. And in the meantime, those small problems like cavities early on or preventative cleanings, those problems are neglected, and those small problems, they fester, they grow until the point where another emergency happens. So it's something that people get caught in this cycle, and they know that they have problems that they need dealt with, but they can't afford to have them treated. And it's important to highlight that the effects of poor oral health go beyond the mouth, as I'm sure our other panelists are going to talk about. But one place I wanted to make sure we focus on is that you can imagine living with visible dental decay or missing front teeth, how difficult it would be to interview for a job. And it's something that affects employability and really is part of one of the factors that gets people stuck in the cycle of poverty. And these problems that I'm talking about so far, they're getting worse. So more people lack access to work-related dental insurance because there's a lot of people who are retiring and losing those benefits, and a lot of people working in the precarious gig economy that doesn't provide benefits like dental insurance. And this is all before trends that are happening before the COVID-19 pandemic. When we put the financial hardship in place from the COVID-19 pandemic, the situation is much worse. There was a study the other day that came out from MNP, an accounting firm, that found that about half of Canadians were within $200 of not being able to make ends meet every month. And this is something that you can imagine. If you have a toothache, you might end up having to put it on the credit card to pay for care, or you're neglecting a cleaning or whatever it might be. So without drastic changes, things are only going to get worse. So because of these problems is why I founded the group Coalition for Dental Care, as well as to advocate for a more humane alternative. And as Don was mentioning, I just want to highlight the NDP dental plan, where they plan on providing dental insurance to families making $70,000 a year or less, and just stress how this would be the single largest investment in oral health in Canadian history, and more than double the amount governments spend on oral health care. So this would be a big step in the right direction, and what we see as a great first step towards including dental care within our universal health care system. The Coalition for Dental Care's ultimate vision for dental care has 3 main components to it. So for one, we think from birth to death, you should be guaranteed dental insurance throughout life. When you lack dental insurance, people neglect things like cleanings and minor procedures, because having insurance changes your usage behavior. The next component is that just because you have dental insurance doesn't mean you necessarily have a dental provider nearby to provide that care. So we also want a strong public sector of publicly owned dental clinics in easily accessible locations like schools, long-term care facilities, prisons, community and Indigenous health centers, so that we can meet the population demands more efficiently. Also, with this public ownership, it allows us to bring dental therapists into the mainstream in Canada, which our other panelists are going to talk about as well, which I think is a very exciting, cost-effective way to help meet the population needs for dental care.
Thank you, Dr. Doucet. That was very informative and for kicking us off. Our next speaker, Dr. Kavita Mathu-Muju, I think is going to talk to us a little bit about the role that dental therapists might play in more effective delivery of dental care, and also maybe speak a little bit about how this has been rolled out in Saskatchewan. So Kavita, over to you.
Thank you, Don, and also thank you for inviting me to be part of this discussion. Got to say, a little bit nervous about the extemporaneous speaking, but I'll carry on. But yeah, Brendan, you mentioned dental therapists. So we actually do have dental therapists in Canada, and I'll just sort of briefly recap the history of dental therapy in Canada. We have had, 1972, we actually had a federal, that's when they started, we had a federal dental therapy program, training program. It started off in Fort Smith in the Northwest Territories, was ultimately relocated to Saskatchewan, and that program was closed in 2011. The function of the dental therapy program, so dental therapy program, so our federal program, it was aimed at addressing the issue of access to care for children in the North. And to this day, the burden of dental care is just disproportionately borne by our Indigenous community members. So the federal dental therapy program, dental therapists say deliberately that program was intended to recruit people from communities. The only prerequisite was finishing high school. There was a really strict, standardized 2-year curriculum for providing primary, preventive, and restorative care for children. And then it was a successful program. And then the dental therapist went back to the community and provided care. Then we had the provincial program that Brandon referenced was in Saskatchewan. And the intent of the Saskatchewan program was to provide school-based care for all children in Saskatchewan. So that program, again, opened up in 1972, the training program. That program ended in 1987. And again, it was a 2-year training program. And I actually would, as a pediatric dentist, I'd really want to advocate here. I'm sure other panelists are going to talk about adults, but I really want to advocate for oral health for children. We're Canadian. It's part of our DNA that all children, it doesn't matter what their economic status is or how affluent their family is, we make sure that all kids in this country get education. We make sure that all kids in this country get healthcare somehow, except when it comes to their mouths. And the dental therapy program, dental therapists, you need to go where the children are. And so the Saskatchewan program was extremely successful because by the end of the program, it was discontinued. It was started by the NDP. It was discontinued in the 80s by the Conservative government of Grant Devine. Lots of changes in the 80s, a move towards sort of free market-based care, and the program was canceled. But what matters about the Saskatchewan dental program, and Don, I heard you talking about money, it was extremely cost effective. The cost of care per child, and I know we can't translate $1986 today, but it dropped by 271% over the course of the program. It was extremely cost effective. It was effective in terms of the delivery of care, like the outcomes for the children. So there was a 43% drop and the number of decayed, missing, and extracted teeth in Saskatchewan children. And the other important thing about dental therapy and dental therapists being based in schools is that you have, and these are children, you have continuity of care. And to successfully provide care for children, you need a continuous relationship. There's a strong emotional component to when you're treating children that you just can't manage in our current sort of fee-for-service delivery system. The important point I want to make is that when I talk about dental therapists and school-based programs, and I think we can do it, this is what Brandon was referencing. This is actually, dental therapists are part of the dental public health workforce. They would be employed and managed provincially, not in the private sector. So Don, I know you're hoping we keep it between 3 to 5 minutes. So I think I'm probably somewhere around there.
That was excellent. Well, thank you for that general overview of that. And I think we can explore that in more detail because it seems like that's a very important resource that we could really be bulking up in the way we deliver services in this country. So thanks for that. We'll now turn to Tiffany Ludwicki. Tiffany, I think you are going to talk a little bit about the concept of a dual dental hygienist, dental therapist type of provider, and also the very important role that prevention plays in oral health and maybe in a universal dental plan. So Tiffany, over to you.
Okay, well, thanks again for having me. And just to follow in order with the discussion, I guess I'll talk about the dual acting dental therapist idea first. So back in 2017, the CDHA Board of Directors did endorse a position paper. It's called Filling the Gap in Oral Healthcare. So what we saw is just the substantial disparities in oral health and the fact that they do persist all across Canada as a result of complex processes that mostly affect access to care. So what we have discussed in that position paper is creating a multi-skilled oral health professional. So someone that has a deeper background in prevention, public education, periodontal care, and the ability to alleviate pain, which is definitely needed to support the underserved, marginalized, and vulnerable populations. So the CDHA, or Canadian Dental Hygienists Association, do strongly believe that it's critical to address the oral health issues and the access to care issues in the development of a dental therapy program. Actually, right now, let me just come up because I want to make sure I get it right here, but the Northern Intertrial Health Authority, Saskatchewan Polytechnic, and the University of Saskatchewan are partnering right now to establish a sole dental therapy program in Canada. So yeah, just with the background, we've also explored the idea of the degree completion with dental hygiene, whether or not to include dental therapy on its own program, or just to have this as a continuing education direction in which a dental hygienist can go. People don't realize that dental hygienists can play multiple roles in the public. I myself have my own independent clinic, so there's no dentist. I collaborate with other people, but I'm changing the access to care for the population in my area, as well as other services that can reach growth and development and different preventative strategies that you might not get within the general standard practice. So having dental hygienists utilized in different areas of public health, there's many routes in which we can go where we are primary health care. We've just been kind of put into the box of just focusing on the mouth. But as we see through all of this discussion, oral health has an enormous impact on overall health of the population. So I'll kind of switch to the preventative side here now. I think it's suitable time. Just in that oral diseases and conditions, they're often preventable, chronic, painful, and disfiguring potentially. They can disrupt our sleep, our eating, even our growth patterns of our facial development and our airway. Dental cavities, they are the #1 childhood disease. So we were discussing children there. And it's preventable. And I do know in a lot of provinces, there are programs in place for children. So obviously we do want to focus on that, and we want to elaborate on that. We want to expand on that. That's what I should say. But we also can't fail to consider that cavities don't stop in childhood. Behaviors, like the preventative side of dental hygiene, is hopefully changing the education, the behaviors behind the risk factors that can lead to the progression of a cavity to something that requires more invasive therapy, something, tooth loss, and then that could lead to the socioeconomic challenges, as Brandon had mentioned. So being able to utilize preventative therapies and services not only may reduce needles, the pain from needles, the suffering experience with poor oral health, but it can improve people's quality of life. And we can take a huge burden off of the whole healthcare system, since much of significant costs are incurred from treating oral diseases outside of dental practices, not to mention the cost of the parents having to take time off work, let's say for their children. It compounds. So just understanding, essential dental hygiene care should be involved in a dental plan, because it can help prevent and eliminate the infection of diseases in the mouth and the associated structures. And these interventions can also allow for individuals to maintain functions, like I mentioned, around sleeping, talking, eating, smiling, which all contribute to overall health and well-being and the quality of life for our population. That's kind of what I had in mind today.
Thank you, Tiffany. Yeah, lots to think about there, and we'll come back to that into our discussion after. So, last but not least, we're going to hear from Dr. Hasan Sheikh. Hasan, I think you're going to tell us a little bit about your experience as an ER physician, seeing people with dental pain, and the general relationship between oral health and overall health.
Absolutely. And thank you for having me, Don. As an emergency room physician, it's a chaotic, busy place, as I'm sure, unfortunately, many of you out there have experienced. And I see basically anything and everything that comes in the door. And there's one particular type of case that is often extremely frustrating to see. And I'm going to just share some slides here that show you what I mean. And that is the following. So often I will see someone come in that looks exactly like this old picture, someone holding their cheek, pacing in the department, looking like they're in excruciating pain. And it's because, the dental pain can be so painful. And what's very frustrating about these cases is that people come in knowing that they need to see a dentist. And I go in seeing them knowing that they need to see a dentist. Yet they've ended up in the emergency department because they have nowhere else to go. They can't afford to seek dental care at that time. And unfortunately, it means that it puts an additional burden on the emergency departments, and we leave our patients unsatisfied and undertreated. The issue really comes down to the fact that oral health is a big part of our overall health, but we treat it somehow like it's not. In medical school, I learned about all these associations between kind of poor oral health and all of these other medical issues. And as I started to dig in more into this, what I realized is that there's actually a lot of causations where when we give people dental care, we see that things like their diabetes gets better, the rates of aspiration pneumonia and long-term care goes down, people's risk of heart attack, their risk categories change. We even see that in some cases it can improve substance use disorder treatment and drug abstinence. And so it has, it's no surprise, your mouth, there's nothing special about it. It is part of your body, and it is a necessary part of our healthcare, just like every other part of the body. Unfortunately, we've done this instead. We've taken dental care and treated it completely outside of our public healthcare system, which we call Medicare. As Brandon talked about, only 5% of all dental care spending is public, and that's about half of what the US spends. Now, it's a real equity issue in this country. When you look at the difference between a low-income Canadian and a high-income Canadian and whether or not they can access a physician, there's a bit of a difference, on par with what we see in our peers like Australia, New Zealand, and the UK. But when you look at the difference between a low-income Canadian and a high-income Canadian, in terms of how they can access a dentist, you see this huge difference where we are, just like an American-style system. And I think once we realize that oral health is part of our overall health, Canadians should find this completely unacceptable. Dental care funding in Canada has gone up steadily over the decades, but when it comes to public spending, it really hasn't budged at all. And we're still sitting around that 5-6% in terms of how much is actually spent publicly. Dental care was something that wasn't included in our universal Medicare system. And a lot of that comes down to the history of it, that, in the 60s when we were creating Medicare, we started to put fluoride in the water. We started to see that, there was this decline in dental caries, and we had this false reassurance that oral health was somehow different, that it wasn't a provider-based component of healthcare. And, unfortunately, our, dental programs that we did have been steadily declining since the 80s. So the consequences of this means that, 1 in 5 Canadians avoid seeing a dentist because they can't afford it. In Ontario, where I practice, 2 to 3 million people can't afford to see a dentist because of cost. And it means that we see this extremely frequently in the emergency department, which to me is a sign of a real policy failure. It means every 9 minutes, someone's going to the ER for dental pain. And that's costing us millions of dollars, upwards of $30 million in Ontario alone. And at a time when we're trying to, reduce our reliance on prescription opiates, this is a source of just another condition where we're kind of scratching our heads saying we don't really have anything else to offer people. And, often it ends up in an opiate prescription, unfortunately, and people still aren't getting the right relief. They still need to see a dentist. And it's the people that are most vulnerable in our society. We've heard about the impact on children. And low-income adults and the working poor who don't have benefits is another, key demographic that is really left behind. Seniors and people who lose their jobs, they lose their benefits when they're no longer working. And, you can see this across various studies in this country where you see that whether you have insurance or not makes a huge difference on whether or not you access care. It means that if you're uninsured, you're more likely to only access care for an emergency, as Brendan alluded to. And it means that if you don't have insurance or if you're low income, you're more likely to have lost your teeth. And that's really not, I think something that is acceptable to Canadians, because we believe in this kind of, the principles of the Canada Health Act, that financial barriers should not prevent you from accessing necessary physical and mental health care. And and oral health as a key component of your overall health is really, it's unacceptable that it's not part of our universal healthcare system, and something we desperately need to address.
Wow, thank you. That was a really powerful overview. So now I think we'll just throw it open to an open discussion. I'm going to ask a few questions to get us started. So what's the barrier? It seems so obvious. I've been looking into this for several months now, actually going on maybe over a year, and it just seems to be a no-brainer that through a historical anomaly, we, as I think, Kavita, you pointed out, we cover everything in our bodies except for this little piece of our body here. Tonsils back is okay, but tonsils forward, we don't. The connection with your overall health, as Hasan just pointed out, is so clear. The need is so great. It seems to offend our basic concepts of healthcare that I think all Canadians are very proud of in this country. Where are the barriers? Why don't we have universal healthcare for everyone in our country? And I guess the other question I would ask is it best delivered through our public healthcare system, or is there some other model that you think we ought to be looking at?
I wouldn't mind kind of chiming in there. I think one of the really important things to note here is that, there are a lot of financial interests at play that do benefit from the existing system, whether that be private health insurance companies, equipment supply, all different types of interests, and even dentists to some extent as well, historically have kind of been on the wrong side of this issue. Now, I think it's something that, as a dentist myself, I think it's really important that we stand up for what we see as the right plan. And I really think that including dental care within our universal healthcare system is essential to ensure everyone has access to dental care for many reasons. But one of them is that the existing targeted programs that we have, they're susceptible to kind of the idea that some people get free stuff, when really we should be looking at it as something that you deserve and everyone should be able to access. And having that two-tiered system results in a stigmatization of the people who rely on those programs. Whereas with universal programs, everyone buys into them, and there's a much greater sense within the society that we take pride in that. And that, say, trying to cut funding for a universal program, there's broad backlash, and it's much harder to do politically than cutting targeted programs which help poor marginalized communities. Very few people notice. And you can cut funding for these programs in underhanded ways by de-indexing fees from inflation. So, over time, the fees that they pay out are far lower than a private plan, or, favoring extractions over trying to save teeth, which, when you're trying to balance the books might look better, but when you look at the quality of life that people actually live, it's not.
If I could chime in as well, and that's a nice summary, Brandon. And by the way, Hasan, nice to see a physician who cares about oral health. I really appreciated your presentation. The barrier, the problem is that what we've done in Canada, and it seems so un-Canadian of us, is that we have, it's an ideological issue. We have made, for some reason, oral health, not the rest of the body, but just our teeth, just our gums, we've commodified it. And I don't think health should be a commodity. It's like a goods and services. So because we've made it a commodity that can be bought and sold, we're relying on the private sector to deliver oral health care. And as a result, we have big gaps in access to care. And I think we have to have as Brandon is describing, a shift back to realizing that we shouldn't have ever commodified oral health. It's a universal social good.
And if I can add to that, I think part of the challenge is, I think, what we went through in the 60s with Medicare. Doctors were, unfortunately, some of the biggest opponents of Medicare when it came through. And I think now if you poll physicians, very few would ever want to go back. And it's because we see the benefits of what it means when our patients can access the healthcare they need, where the decisions about who gets access and what type of care they get is made based on, their health outcomes and not their finances. And I think that, like we're seeing with the debate around pharmacare, dental care is one of those things where once we make that investment publicly, yes, it's going to mean a little bit more spending publicly, but it's going to save us much more money privately. And I think all of us are going to be better off in the long run. And I think once we have the bravery to take that step, like we did with Medicare, we're never going to go back. No one's going to go back to this type of system once they see the world the way it is when we have, a properly single payer funded dental system.
A fun historical fact when I was researching the introduction of Medicare in the 60s was, of course, there was a groundbreaking study done by Justice Emmett Hall called the Hall Report that laid the foundation. And he was appointed by a conservative Prime Minister, John Diefenbaker, and asked to look into the provision of healthcare services, and really, frankly, shocked everybody when he came out with his recommendation for universal healthcare. But the implication for dental care was he actually recommended in the 1960s that dental care be part of our public system. And the only reason that it wasn't at that time was it was determined that we didn't have a sufficient number of dentists in Canada per 1,000 people to actually deliver services through the public system. Now we've surpassed that ratio long ago, so that's no longer an issue. But it's interesting how there's no principled reason why dental care is not part of our public healthcare system. It was almost an accident of history. It was a pure supply issue at the time. Tiffany, from your profession with dental hygienists, I wonder if you could give us an idea, what's the general feeling among dental hygienists about, the lack of equity and access to care and what they would like to see happen? Would they like to see dental care folded into our public healthcare system, do you think?
Yeah, so on behalf, I have one of those moving tables. On behalf of CDHA, we are really focused on increasing access to care. So we have an RFP going out there because we would like to get information regarding the low economic barriers, what are the seniors facing, different disparities. So we want to put resources towards advocating for these services, standardization, making sure that we're getting quality care for all the population. And then I'm going to talk a little outside of the CDHA now, just for clarity. I'm speaking now on behalf of Tiffany Ludwicki and some colleagues that I've had discussions with, is even patients or clients, because they don't always have to be sick, who have insurance, they base their decision on their insurance program, not on their needs. So like when I see a client, this is the best case for them, but they can't even pay the copay. So they'll decide one route, which is not the ideal route. which could then, let's say they do have to extract some teeth, and now they don't have the same structure in their jaw, and their cheeks, let's say, sink in a little bit. Well, now I'm going to go on to the systemic aspect, is now you're increasing your risk for snoring and inflammation in the airways, and then at night you're leading to sleep apnea, high blood pressure, and you're just progressing a situation because you decided you didn't want to pay the copay of your insurance, let alone the people that don't even have insurance. So the need from a preventative side is astronomical versus just treating pain. Like, we really want to get it at the core. We want to solve the root cause. So it's definitely something that we want to see come.
Just to add to what you're saying as well, I think it's really important point to stress what you said about, like, when we talk about 1 in 3 Canadians lack dental insurance, we don't highlight the fact enough that even people who have insurance oftentimes are underinsured because they have, high co-payments, deductibles, they have yearly limits that, they need more care. And it really highlights how private health insurance companies work. And they view people who are high risk dental wise, so they need a lot of work. They don't like those people because they have to pay out more in benefits towards these people. Whereas when you have a universal healthcare system, everyone's kind of in the same pot and you're able to allocate resources more equitably. Another point I wanted to say as well is I find when I'm speaking with colleagues of mine who tend to be hesitant of, being for, say, a universal single payer dental care system, is like, fundamentally, do we want to be salespeople or healthcare providers? And that's the choice that's really at play here. And, because of history, as has already been talked about, we're largely sectioned off to the salespeople section. And a lot of people, they go to their dentist as if they're going to a used car salesman, because they go into it with that hesitation. And there's actually a study done, I think it was about 10 years ago, that showed that people see dentists more as business people than they do as healthcare providers. And I think it's something that we need to rebuild, that public trust, because a lot of people do have that hesitation going in. And I think building a universal dental plan and also having things like, government regulation over, watching how many cavities are diagnosed and things like that can do a lot of good as far as rebuilding that public trust.
Yeah, I agree. I think there's still a stigma that attending to oral health and dental care sometimes is cosmetic, or it's an issue. It's a voluntary thing as opposed to one of primary health. Kavita, I want to sort of zero in on children. I've often thought, and by the way, I'll announce my bias. I'm in total favor of having all dental services folded right into our public healthcare system. And by the way, in terms of dentists, I know dentists worry about their salaries. I don't see any reason why we couldn't negotiate fee schedules, just like we do for every other doc that we have. We pay heart surgeons, we pay internists, we pay GPs, psychiatrists. It's all negotiated through fee schedules. The system works well. I don't understand why we couldn't do the same thing with dentists and all allied health professionals as well. But I've already talked about how we've thought about it until we get there. We've proposed a plan to cover everybody on sort of an economic basis, everybody under 70,000. But I've often thought, what if we did a down payment on universality by covering, let's say, everybody under the age of 18? I'm not proposing that, but it's just as a thought bubble. What would it do to our country if we made sure every child from birth to 18 had all the dental care that they needed? What would that do in terms of setting them up for better oral health as adults?
That's a great question, Don. When you were talking about costs, and I'm going to sort of segue a little bit away from your question, because I know you always have to think about costs when you're thinking about our public dollars. So in terms of if all children could have access to care, so the dental therapy model is a public health delivery model. So, and by the way, Brandon, you make some great points that our monopoly into practice dentistry, it's our social contract with the public. We're supposed to make sure everybody gets care, and that's not happening. That social contract is eroding, which is why we're having this discussion. But Don, in terms of ensuring that there was, so the Canadian Center, so it's not my work, the Canadian Center for Health Policy Alternatives, so I'm reading off of here, in 2011, asked this question. So if we revitalized the Saskatchewan approach, having dental therapists go into schools and like a dental public health workforce to provide preventive and restorative care for all children across Canada, not just Saskatchewan. And so using Stats Canada data, they said, okay, 3.7 million children aged 5 to 14 in Canada in 2010. So if 85% of children enrolled in this kind of a program, and the Saskatchewan program had well over 80% enrollment, the price tag, adjusted for inflation, for Canada would be around 560 million Canada-wide, which would represent just 4.1% of all the costs we spend on dental care. So I think that's a pretty small price to pay for all children getting the care they need to be set up to move forward in life, to the things that Brandon described, to be able to go in to apply for a job or go to university with confidence.
I think something to add to what you were saying as well is that that school-based model makes things much more accessible as well than the private practice model. So you're actually ensuring everyone can get into those clinics as well. So like over the time of the Saskatchewan Dental Plan, as you've mentioned earlier, the need for things like fillings and extractions went down by almost half because those preventative and early kind of intervention steps and education were so easily accessible and everyone got it. It really goes a long way. And especially when we look at for children, I'm pretty sure day surgeries is the most common day surgery because children come in at such a late stage. And if we had these services be very easily accessible through a school-based dental plan, we could lower the number of day surgeries. You can imagine how traumatic that would be for a child to go through that. But at some point when they come into your office in such bad shape, you have no choice because you can't get the work done in the chair. And I think, we could apply that same model for other places as well, like long-term care facilities and other places as well.
That is a great point, Brandon. There's certainly been studies, especially in First Nations communities. What happened is when a dental therapist first went into the community, and as you described, there was a lot of, in particular communities, a lot of unmet needs. So the first thing you'd see over time, the number of extractions would first start to go down over time, the number of restorations would go down over time, and the number of preventive procedures went up over time, because that continuity of presence of someone who cared about and was invested in the community meant that the oral health of the population improved over time. Yeah, thank you, Brandon, for bringing that up. That's a really important point.
Hasan, I've got a double barrel question for you. One, I read, I don't know if this is accurate, but a fairly shocking statistic that 1 million Canadians have chewing problems. And so I'm just wondering, the first part of my question, is that true? And if so, what are the sort of implications of that for nutrition and overall health? And second, what do you do when someone comes into the emergency department with that pain in the cheek? I take it you don't have dental chairs, you can't do fillings and crown restoration. So what care are people getting in the emergency departments of this country when they present with dental problems?
Yeah, that's a great question, Don. And I don't know the specifics about that statistic. I think that, undermet oral health needs is extremely common. So that statistic doesn't surprise me at all if it is accurate. What often happens when someone comes into the emergency department is, as I said, they know they need to see a dentist. I know they need to see a dentist. I'm trained in some components of an oral health exam and having an idea of what to do, but I certainly am not trained the same way, a practicing dentist would be. Don't have the same equipment, don't have the same ability to do those procedures to actually fix the issue. And so often I'm kind of looking and saying, maybe there's dental carie there, maybe there's, an early infection, and we end up having this discussion, should we put you on antibiotics, which, really most of the time wouldn't be necessary if you were able to see a dentist quickly. And that means that we're contributing to this big overall problem of antibiotic resistance. then we're talking about, well, what about for pain? We're trying anti-inflammatories, acetaminophen, and then that may or may not be enough for people. Most of the time it's not. And then we have this discussion of, do we put you on a prescription opiate for this? Again, knowing that you still need to see a dentist. None of the stuff we've done by the end of your emerge visit actually helps you, fix the issue. And so often what we're doing is kind of connecting people to the kind of lower cost dental resources in the community. And that's kind of our biggest role in the emergency department. But I don't leave those, interactions feeling like I'm really giving people the care that they need, nor do they feel like they're getting the care that they need. And really, it's just, I think, a real shame overall.
Thanks. And Brandon, I saw you flash a statistic from the Public Health Agency. It was actually 1.8 million Canadians have difficulty chewing, I suppose. So Brandon, do you have any thoughts on that? Like, what if you can't chew? I know it seems pretty basic, and I have my grandmother, her words ringing in my mind that you are what you eat. How does that impact overall health?
Well, I mean, you can't really have a nutritious diet, or at least it's going to be much, much more difficult. And I think also something to realize is that those 1.8 million people, think of the quality of life they live, because a lot of people, the reason they can't chew is because it's too painful, because they have broken down teeth and active infection that they can't afford to get treated. They have no teeth at all because, maybe they could afford to get all their teeth extracted, but they couldn't afford their dentures. And I see that, people have to wait years. Or, their dentures, they've had them. I see patients come in who say, I've had my dentures for 30 years. I've had them since I was, young. And they don't fit well enough to stay in their mouth anymore, but they can't afford to get new ones. So it's something that, oh, sorry.
No, I just want to take a second as well to answer that, Don, if I have a few moments. The inability to chew properly, just the fact of chewing alone starts our digestion. And so if we consider the amount of people that have acid reflux, it's likely they're not digesting their food properly. It's getting into their stomach and it's actually fermenting in their stomach. They're releasing all this gas that's not necessarily stomach acid gas. It's the fermenting food in their stomach because they haven't been able to digest the food initially in their mouth. That acid is then coming up through their esophagus. We're ending up with esophageal cancers. We're eroding our enamel away and creating other issues, GI. Like the mouth is the very first part of digestion. And so if we're seeing inflamed tissues in the mouth, we're likely seeing inflamed tissues all throughout the entire body, of the whole GI system. And then if we're not digesting our food properly, then we're allowing larger fragments of food to get into our system. The body is seeing these as foreign objects. We're creating inflammatory issues throughout the entire body, and our body's starting to attack itself. And not to mention most of serotonin, our happy feel-good hormone, we think it's in our brain and we're treating all of these depression and anxiety, yet it's undigested food. It's, the stomach that has more bacteria in our stomach creating serotonin than what's actually created in our brain. So we've separated the whole body, but everything is needed and so much starts in the mouth. And so I think that's a huge topic, and I could go on and on and on. I have a whole health coaching background as well in regards to this and the whole holistic thing. So I love exploring this, but just to understand even just how the chewing can potentially lead to GI issues and mental health issues as well, let alone just the stuff that we see on the outside.
One more part to add to that as well. So this is that statistic that you mentioned comes from a Public Health Agency of Canada study. And they also highlighted kind of the class divide for this. So this is something I want to focus on as well. So it showed that people who have a permanent disability that leaves them unable to work, they're 4 times more likely to be unable to chew than the people who are employed. People who have less than a high school diploma are 3 times more likely than those with university degree. Those with, the lowest income group are 3 times more likely than those in the top income group. So it really highlights how this is something that affects certain groups more than others. And we know the statistics of what groups experience poverty more than others. And there are very large factors like systemic racism that are at play here. So I do think that looking at universal dental care as, everyone should have a right to this, it's also, it cuts across a lot of other divides as well.
I wonder, I think it's obvious and it's emerging from different points that are being made by all of you today, but we're also talking about our face, and we're talking about something that's it's what we present to the world. And let's face it, there's a class issue with teeth. As we've said, if someone shows up for a job interview and they're missing a front tooth, we make assumptions about that person. I'm just wondering, are any of you familiar with any studies or linkages between mental health, psychological well-being, depression, anxiety, and poor oral health? It seems like a pretty obvious connection to me, but is that sort of empirically linked in any way?
So for children, poor oral health is, I'm not aware of the issues around, but it's certainly linked with failure to thrive, with missing school days, with cost to parents in trips to the emergency room or trips to the dentist in terms of a neglected oral health. Sorry, Don, if I could add one more thing. As to you asked, like, what's the problem? Why are we stuck here? Part of the problem is not all dentists, but is dentists themselves. So you mentioned, and Brandon's talked about, like a universal insurance program, which the assumption almost is that would be delivered by dentists in the private sector. But part of the issue when we talk about expanding our delivery of oral health care to include or to expand our dental public health workforce in the terms of dental therapists, the opposition has come predominantly from dentists. And that is because as others have eloquently described, Brandon certainly has, is that we still, the social contract has eroded. That, as Brandon has said, we're perceived as a seller of something versus someone you come to for provision of your oral health. And I think that moving forward is something that we need to address, break that barrier down. In Saskatchewan, very successful dental therapy program, the biggest opponents to the school-based dental therapy program in Saskatchewan were the Saskatchewan dentists. They didn't want it. 3 or 4 years after the program was initiated and was going quite well, what happened? None of them went out of business. None of them lost their livelihood. No dentist went bankrupt because of the dental therapy program. What actually happened is that the dentist found that they may have been treating fewer numbers of children. They were treating more adults, and they were providing more complex procedures for adults, which is what we should be doing as dentists. But that's a hard message to get across.
We only have a few minutes left, so what I'm going to do is I'm going to elect all of you to be the Government of Canada. Kavita, you could be Prime Minister. Tiffany, you're Minister of Health. Brandon, you're Minister of Finance. Hasan, you're Minister in charge of dental care. What would you do? What are the next steps?
We're going to amend the Canada Health Act. We're going to break that open.
That was actually, I was having a discussion yesterday. I was on another panel discussion with the Federation of Canadian Dental Students. And one of the topics we talked about of how to change policy is, doing exactly what we do with the Canada Health Act of, having the federal government provide funding to provincial governments to provide dental care to the population with the condition that they meet certain criteria like we do with the Canada Health Act. So some of the criteria, comprehensiveness, accessibility, portability, universality, public administration. And the funny thing is if we were to test dental care for that now, we'd fail every single one of them, and kind of tying funds to that could be a really good way to help lift people up or, raise the standard of care for everyone. Also, another thing I think is really important to note as well is when we fund a universal dental plan, like we would do that through taxation. And what we can do is actually shift the burden of who foots the bill for that onto the wealthy. And that's something that it's very important because Canadians are going through financial hardship right now. They have been for a long time. Inequality has been skyrocketing. But since the COVID-19 pandemic, it's become an unbelievably bad situation. So I saw a statistic the other day from the Canadian Center for Policy Alternatives that said, since the pandemic, the billionaires in Canada have raised their wealth by $78 billion. That's an inconceivable amount of money while most people are struggling. So while, yes, a universal dental plan is going to increase taxes, the burden of that can be shifted onto people who are well off, while we're also eliminating private payments to private health insurance plans and out-of-pocket payments as well.
Tiffany?
Okay, so I have the health part. I'm going to take a little bit of Brandon's. I do think one of the challenge is the allocation of funds. I think it is important to have them designated into certain roles that each province will get a certain amount of money to then place in a certain program. I think it should be standardized across Canada. I think that's important if we want equality across Canada. But ultimately, we have to change the paradigm. We have to change from sick care to health care. That's where it is. If we want the future, and I know we want to consider everybody along the way, but starting right from a young child, it's going to cost more up front as we fix the problems and we switch. So get ready for the ride, but yeah, let's change the paradigm.
Last word to you, Hasan.
So I think that exactly what the others have talked about, a single payer universal dental care system with, that's federally kind of distributed to the provinces with certain conditions that we all agree on is part of our social safety net. And I would just bring up one other point, which is in addition to this public financing piece, is the ability to leverage that public financing when we do public delivery. And that Saskatchewan model is a really great example of how we can provide care at a much cheaper cost in the right place for the people who need it the most. And these are things that you can only do with a universal publicly funded system. And so the potential to do this in the most cost-effective way and the best way for every Canadian is there if we bring this into our publicly funded healthcare system.
Well, thank you. I've got an eye on the clock and it looks like we're out of time. I just want to really profoundly thank each one of you for your thoughtful, very, very thoughtful and perceptive observations and contributions. And I want to thank you for the skill that you not only bring to the delivery of healthcare in Canada, but the compassion that you're showing. I think it takes a lot of courage to stand up and talk about the gaps in our system. And it heartens me and really inspires me to know that there's healthcare professionals like all of you who are working to build our healthcare system so that we can ensure that the promise that I think we all are so proud of in this country of making sure everyone can get access to the healthcare they need with their health card, not their credit card, comes to pass comprehensively and not just for physician care and hospital care. So thank you very much. I look forward to our next forum, and we'll just keep carrying the message forward and won't stop working until everybody in this country can get the oral health care they need. Thanks very much, everybody. Have a great afternoon.
Thanks so much. Take care.
Thank you.
Thank you.